Amy says, do you recommend Reglan for gastroparesis after the Ivor Lewis
Mhm.
esophagectomy? Also,
Right.
please pardon me if I pronounced that
Yep.
incorrectly.
No, that's correct. Ivor Lewis is a pronunciation. I think you did a good job. Um,
Thank
so, about 15%, maybe 20% of patients have some delayed emptying of the conduit. We don't usually call it gastroparesis, but that's another name for it when you don't do surgery. We call it delayed emptying, delayed gastric emptying. Um, but it is true that the stomach does not squeeze, the stomach muscles do not squeeze the way they would in a patient that has not had surgery on the stomach. And that gastroparesis or delayed gastric emptying often improves over the course of the first few weeks after surgery. However, there are patients who still suffer from this, and I do use Reglan routinely. If patient has, when I start them on liquid diet in the hospital, if they complain of early satiety, if they complain that they feel full after taking a small amount of liquids, I do give them Reglan in a scheduled manner, not as a as needed PRN basis, but I schedule it 2 to 3 times a day, and and I send them home on that. So yes, I use that, and I use it probably, 40-30% of my patients end up needing that.
Yeah, wow. Well, Dr. Burnett, any sort of, last words or last topic you want to leave us on here? This has been really, really fascinating.
Sure. You know, esophagus cancer is a tough cancer to treat. That's for sure. And it's a tough cancer from the standpoint of the patient and the clinician. It's a cancer that absolutely needs, a multidisciplinary team of medical oncologists, radiation oncologists, surgical oncologists, and dietitians, physical therapists, and so on. And but having said that, it, it is evolving in how we treat it year by year, as you can see from the addition of the immunotherapy. And I think that no matter what your stage, we have acquired new ways to address it and deal with it. And I think that those things, those new approaches, are cause for optimism. And I think it's important to approach it with optimism and collaboration with your clinicians. And I think that will serve every patient well, and important to just feel that you can have a good outcome even when you have a difficult cancer, and be optimistic. So I hope that that is a message that I leave with the audience.